Hi friend, myself Dr. Surjit Ghosh from Kolkata, India. Today's subject of discussion is what is Cytomegalo Virus (CMV) and why is it rampant nowadays? Cytomegalo virus is a type of herpes virus by which 80% of us are already infected. But when our health is in a good shape, this opportunistic virus resides within our system silently without causing any symptom of disease. However, when due to some reason our body immunity is on a low ebb, this swashbuckler means the one who tortures the weak only, wakes up and torments us with grave painful troubles, often causing death. CMV causes the inflicted cells to turn bigger and huge. As such, this virus is called cytomegalo. Cyto means cells. The term cyto relates to cells, and big relates to megalo. Now let us just see the images here. This is the microscopic view, actually ultra microscopic view of virus CMV, and this is the cells which have been infected and has grown larger. Who are predisposed to cytomegalovirus infection? Number 1, HIV patients. Number 2, cancer patient. Number 3, patients with transplanted organs. Number 4, patient receiving steroid for many days. Number 5, bone marrow or stem cell transplanted persons. Number 6, those who receiving immunosuppressive drugs for many days. Taking all this thing in a single brace, we can call it persons with weak immune power. All these persons are very weak in immune power. These persons are predisposed to cytomegalovirus. How does CMV infection spread? This is the most important of this video. From physical contact of body fluids like blood, urine, saliva, breast milk, tear, semen, vaginal fluid, etc. of persons with active CMV infection to body fluid of healthy persons. There must be contact of body fluid to body fluid. As also these actions, that is kissing, normal sex, oral sex, anal sex, breastfeeding, these are also very much this cause CMV infection. It does not spread by touch or hug. Let's just say a simple image has been shown here. Two persons are shaking hands. Through this shaking hands or just mere touching of utensils or coats or something used by the person, by this procedure, the infection doesn't spread. Why is CMV infection so rampant nowadays? These days, lakhs of persons are affected with COVID-19 pandemic. It is known to us. Many a doctor used to treat such cases with steroid therapy indiscriminately, though there is a standard protocol for utilizing this therapy. Because the steroid therapy has got its drawbacks. So it is used with some fixed protocols, not in all cases. At least doctor says that it should not be used in all cases. But a lot of doctors use this frequently. Steroid magic relieves a lot of patients from the clutch of COVID-19, but it weakens the immune system of the patients to a great extent. This is the most important thing for which presently this infection is on the rise. This steroid are weakening the immune system of the patient. As a result, otherwise harmless microbes like black fungus, We have already discussed black fungus. I have actually made a video already. It is already published say few weeks ago. Like for black fungus, CMV, they are otherwise very harmless. Inflict severe injuries to the systems of the patient, sometimes causing death. Because the system is now weak. The system is weak, so they are coming. They are now torturing. It appears that it is a dilemma of medical treatment, because if such opportunist microbes come one after another to create grave troubles to COVID-19 convalescents, can we be able to cope up with the total situation in the long run? The whole thing has been shown here. In schematically, COVID-19 patient, steroid therapy is coming, COVID-19 convalescents, and they are attacked by black fungus CMV. It is something we raising questions against whether this procedure is okay. What are symptoms of CMV infection? Number 1, sore throat, cough. Number 2, muscle ache. Number 3, great fatigue. Number 4, swollen glands. Number 5, fever. Number 6, abdominal pain and bloody diarrhea, that is colitis. Number 8, fast weight loss. Number 9, retinitis, hepatitis, esophagitis, gastritis, pneumonia, encephalitis. These are actually serious symptoms. The last ones are the serious, and the starting one are the initial symptoms. In which cities of India cases of CMV infection have been noticed as on 16/7/2021? Delhi, Pune, Bengaluru, Kolkata. Total victims, number of total victims less than 50. Number of deaths is less than 10. However, in each case of death, doctors left uncertainty to certify that the case fully related to CMV. This is the problem. The doctors are not sure whether everything is in a cloudy situation. When to consult a doctor? If you are apparently healthy but suddenly affected by 3 of the following symptoms, you must consult doctors. Number 1, sore throat cough. Number 2, muscle ache. Number 3, fatigue. Number 4, fever. 5, swelling. 6, weakness of vision and abdominal pain. Actually, these total symptoms are shown in a particular disease called mononucleosis. That's why it is mononucleosis. The symptoms of mononucleosis, if suddenly appears in a healthy person, he should consult doctor immediately. If you have an immunocompromised system, that is, if your system has got weak immune power, you know that because doctor has already shown that you are taking so much diseases, so much treatment of the following diseases. As such, your immune system is low wave. Now, if you know this, and you happens to be a COVID-19 convalescent, this is also, if you are COVID-19 convalescent or otherwise immunocompromised patient, then sudden appearance of colitis, that is abdominal pain and bloody diarrhea, are the most warning signals to consult doctors immediately. Please go through this picture to know the infectious mononucleosis symptoms. The symptoms have been given 1, 2, 3, 4, 5, 6, 7, 8, 9. The total symptoms have been given mononucleosis. These symptoms appears with the affection of CMV infections. What complications may arise from CMV infections? Number 1, loss of vision due to retinitis. Number 2, colitis, hepatitis, esophagitis, pneumonitis, encephalitis, and final death. Now we just consult these images. All these images, encephalitis may be caused by various reasons, pneumonitis for various reasons, retinitis from various reasons, but all these images relates to CMV infection. CMV infection, from CMV infection retinitis, from CMV infection colitis, from CMV infection hepatitis, from CMV infection pneumonitis or pneumonia, you can call this also pneumonia, and encephalitis, that is affection of brain. With this, the video ends here. If you feel any difficulties, please write in the comment section of the video. I will certainly respond to it. Thanks.